Okay, let's start this webinar, IOF Operation 2020. Good morning, good afternoon, or good evening to everybody. Good morning, Esther, and thank you for your little chat. Thank you very much, everybody, for joining this online webinar. Here we have Emma, who is a new team member from the External Development team, and myself, Caroline, as the Chief Operating Officer of the IOF. Just to give you a quick historic reason for this webinar, this is the second webinar we are organizing after the suggestion from partners from the Committee of Corporate Advisors that suggested us to present the operation in advance so that the partners can prepare and set up their budget for the following year. I'm going to do a very, very brief presentation of IOF for those who don't know us yet, and also to present you the bone film today and in the future, and then the operation themselves. You can ask questions on the chat on the side of the screen, and I'll do my best to answer them as you ask them. This webinar and slides will be recorded and will be shared after, and we will send you the link to upload the webinar. And then we will be happy to set up meetings or call if you want to discuss further into detail some of the operations. I hope you can all see the screen. Okay, so that's the second slide. Hopefully you can see it. So about IOF, very, very briefly, we are the largest NGO dedicated to osteoporosis and musculoskeletal diseases. We have a global presence and headquarters here in Europe, in Switzerland, and 3 regional offices in Latin America, Asia Pacific, and Middle East. With our society members, we are covering more than 83% of the global population, representing 6 billion people. And we are founded 20 years ago. Our global network with the 3 different committees that we have and the 2 main committees, the CNS members, we have 248 patient and medical societies in 100 countries, and we have 159 scientific experts in the world. The bone field. This is a very complicated and very important field. Today, the population is aging. As you can see on the graph here, this is something that everybody is aware of. The population is aging, and mainly in the north hemisphere of the globe. Musculoskeletal diseases represent a big part of the diseases, as you can see on the second graph on the right-hand side, which means that the osteoporosis and other musculoskeletal diseases will be definitely in 1 decade, 2, 3 decades, a major issue for patients, for the global population, but also for the healthcare professional and mainly for the policymakers. Historically, IOF was dealing before with the scientists, and we were mainly focused on research, working groups, and education of healthcare professionals, raising awareness also on osteoporosis for healthcare professionals, for them to consider more this disease and to start the dialogue and to educate the patient. This is something that we are doing for years now, but for the last 2-3 years, I would say, IOF is swifting a little bit the message. We are still continuing the education of healthcare professionals with different programs that we will discuss later. But we have a big focus now on the patient himself and on the policymakers. Due to this aging population and the fact that the identification of the patient is largely not enough, there is a huge need for primary prevention and also for secondary prevention. We are catching more or less 20% of the patients that have osteoporosis, which is a catastrophe. So we need to change the situation, and we need to identify more the patient. We need to educate and inform the patient, and we need also to advocate to the policymakers to make osteoporosis in the top of the list of national health priorities. One of the missions that we have is to inform about the consequences of of an aging population and about the impact of osteoporosis and fractures. Decrease the life expectancy, decrease the quality of life. There is a big social impact. And of course, in terms of economic and costs, the consequences are huge. Our strategy for 2020, definitely we are not going to reinvent the wheel, and we are going to pursue our efforts we started 3 years ago, which means replace osteoporosis and bone diseases in the top of the national health priorities. We need to change the perception of the disease, and we need to inform on the burden and the consequences of the disease in terms of quality of life, morbidity, and mortality. Which are our goals? Definitely. Our objective and priorities are to raise awareness to the population at risk of osteoporosis, empower the population at risk, urge the policymaker to take actions to make osteoporosis a national priority, and still we are continuing to educate healthcare professionals on the management of the disease. Based on this strategy and goals and on the picture that we have of the bone field today and for the future, here are the two main axes for our operations for 2020 and also for the future. First, science and education, which is the reason why, in parallel to the launch of the new website, which will happen most probably in Barcelona next year during the WCO Congress, we are going to launch the Educational Hub, which implies the IOF OPEX webinar. OPEX stands for Osteoporosis Experts webinar, the IOF Academies, and the training courses. Of course, we are going to continue the very important work done within the program of Capture the Fracture with the benefit calculator, but with also the program Getting to Gold. Nutrition initiative, we started this initiative few years ago, and I am very proud to say that it was a success. So we will continue this initiative. And of course, in terms of science and education, we are going to run our congresses, the WCO Congress, which will not be presented today, but also the IOF regional meeting that will take place next year in Asia Pacific, end of the year. But also awareness and advocacy. Awareness for the patient and patient at risk, and advocacy for the policymakers. Started last year, the patient initiative, we will continue this initiative with the patient awareness communication tools that we will continue to develop, which implies also a very specific and targeted online and digital communication, plus different initiatives that we have to put the patient in the front of the scene. The CNS Day, the second edition of the CNS Day, the Patient National Society Day, in Barcelona next year, which will be the second edition following the first edition we had this year, which was this year, the edition in Paris, a great success. So let's continue that next year. And a very new program called the Patient Advisory Board. World Osteoporosis Day, of course, one of our major awareness and advocacy event. And by the way, the World Osteoporosis Day 19 is just in 17 days from now. So I hope everybody is on tracks for this important operation, including, of course, the new IOF Risk Check and the Global Patient Charter. Last but not least, the Policymakers Forum, that was an operation we were discussing 2 years ago. We started to implement last year, and this year we started to have real forum and closed door meeting with the policymaker. Let's go deeper into the operations. The Educational Hub, that is going to be a global library with all the official scientific resources available on the bone health. We want to have this Educational Hub as the one unique, global, and scientifically credible library online with all the scientific resources to continue the education of healthcare professionals. On one side, but on the other side, we're going to have also one part for the patient because patients need also to be educated. So we're going to gather all the material that we already have, like the slide deck, the fact sheet, scientific papers, webinars, interviews of experts, but much more little by little in the future in terms of training courses or other online solution to educate healthcare professionals. This program will target, of course, all the healthcare professionals, the scientists, the scientific national societies, students, young investigators. This will be global for the moment. That will be in English, but also we're going to upload all the material that we have translated online. As I said in my introduction, this educational hub will be presented and launched during the World Congress in Barcelona next year, in parallel to the launch of the IOF new website. Your role and your benefits will be, of course, to support the education of healthcare professionals and to generate a new generation of scientists and HCPs, because providing with this up-to-date resources of education. The OPEX webinar, Osteoporosis Experts webinar, that's some kind of new operation that we are going to launch from January next year. We have, as I presented in my introduction, more than 150 experts worldwide in the committee of the scientific advisors. And these experts are going to present in a dedicated webinar a specific topic, deeply presented and with a Q&A session. This will be global. Again, that will be mainly in English, but as we have international experts, we are going also to envisage to have translated or directly in another language a webinar. IOF Academy, for those who were present in Paris last April, we launched this year the IOF Calcium Academy, and I'm very proud to say that this was a success. The objective of this academy is to focus on one specific topic and to support the next generation of scientists and help the rising stars in their scientific work. Basically, we're going to have 4 different topics because we have the Calcium Academy, but we are very keen to develop other academies, and I'm thinking of skeletal rod disorders, for instance, or eventually capture the fracture, or any other specific topic, and suggestions are more than welcome. For each academy, we're going to have a committee of scientific advisors that will select abstracts from young investigators for each congress that we are going to organize. This young investigator will be rewarded with a ceremony during WCO and will be offered a financial grant and a specific link to discuss with the scientific advisors, members of the committee of the academy. And of course, we are going to communicate on this initiative. Training courses. We have 2 main training courses currently. The first one is the skeletal rod disorder training course. We already have 3 courses that were successes, one in Geneva, one in St. Petersburg, Russia, and one in Tel Aviv, Israel. And we are planning to have other training courses in the UK, in Mexico. Singapore is the next edition in November this year. Iran is also applying for a training course, and some other countries are also very interested to have training courses. These training courses are organized with the support of a core faculty of experts in skeletal rod disorders. It's a 1-day course, and the objectives are to have a better understanding of rare bone disorders, a better identification of patients suffering from rare bone disorders, and to have a better offer of appropriate targeted therapies. The main objective, I would say, is to raise the interest to healthcare professionals and bone doctors on patients that can suffer from skeletal rare disorders. We have the opportunity with our huge network of doctors and bone doctors to have access to patients that can suffer from skeletal rare disorders. And we can, on one side, support the education of the doctor so that they can better identify the patient with these kind of disorders. And second, to propose a support for and a better care for the patient having these disorders. The second training course that we have is a long-standing course that IOF is organizing in collaboration with ISCD, the International Society for Clinical Densitometry. We are organizing basically, I would say, 20 courses per year in 20 different countries. This is a very successful course that we are organizing with a focus on densitometry, diagnosis, and management of osteoporosis on both sides, the clinical side and the technical side. We are going to refresh and revamp this osteoporosis course in the coming weeks, and the new version of the osteoporosis essential course should be available by April next year, I would say. This is a very important course that helps us to educate the healthcare professional and to push a better diagnosis and management of the disease. Capture the Fracture program, flagship operation for IOF since 2012 when it was launched. This is a very important program in secondary fracture prevention. So this program was launched in 2012, and the objective of this project was to create a multidisciplinary team within a hospital or a clinic to have a better patient pathway and a better patient care. Just to give you an example, if an old woman has a hip fracture, she goes to the hospital, she gets treated or repaired by the orthopedic surgeon, and then she goes back home without any question or interest from other therapeutic doctors, specialties. So this multidisciplinary team organized around the nurse will consider the patient and will drive the patient into the pathway so that the patient will be diagnosed for osteoporosis or not, and then will receive prevention and treatment. The objective is definitely to prevent from fracture cascade. Within this program, we have 3 different operations that we are running for the moment, supporting the education of the FLS members, that's fracture liaison services, that are the services, multidisciplinary services that are in the clinics or hospital. So supporting the education of this member, to monitor strategies for the members, and to make surveys also with the support of the fracture liaison services members. To date, we are very proud to say that we have more than 371 fracture liaison services across 43 countries. This is a very good number, but definitely we want to raise this number. Our objective is to increase the number of fracture liaison services, to implement a Getting to Goal program for the existing FLS, but I'll come back to that later, to adapt the criteria of the best practice framework to regional and national specificities, particularly in Asia Pacific and Latin America, reinforce collaboration with regional alliances, provide education for the healthcare professional, and solution for the global fracture liaison services who started. The Getting to Goal Standard, it's a new program that we are just starting. We have a pilot program in Mexico, which has for objective to develop an international team of fracture liaison services experts, local mentors to deliver the mentorship framework, to develop a current mentorship program of activities and content that address the needs of stakeholders, and develop from policy to sustainability. Definitely the idea is from the application that we receive for the fracture liaison service to the bronze standard ranking to get to the gold standard, and to maintain this gold standard, and to keep the momentum of the motivation of the fracture liaison services to provide a better patient care. Still, the objective is to evaluate the impact of the mentorship framework and to obviously reduce the economic burden of osteoporosis with a better management of the patient. IOF Benefit Calculator, this is a program that was proposed last year and that is starting this year and will continue next year and in the future. IOF Scientific Development Algorithm, where the aim is to provide an online tool for multiple stakeholders to produce national and local estimates of benefits from introducing a fracture liaison services that requires a minimal ongoing support for sustainability. To make a long story short, implementing a fracture liaison services represents a cost for an hospital and for the administration department of an hospital. And we have to convince the administration of the hospital the benefits of implementing such a fracture liaison services. Not only the administrative department of an hospital, but also the policymakers. And this is the reason why the benefit calculator was thought and launched, is also to convince the policymaker of the goodwill of the implementation of a fracture liaison service. Objective, obviously, to strengthen the prioritization of the fracture liaison service at the country level, empower local champions with independent local data to get support and funding for their application and business, and inform about the gaps in data evidence that need to be prioritized to improve national and local budget impact model. This year, we are working on the development of the algorithm itself, and we are working also on 2 different countries. For those who already know the IOF FRAX algorithm, we can make a parallel with the benefit calculator. Each country will have its own benefit calculator. So we are starting with Japan and Spain, and we are looking for support and partnership to develop other countries for the future. Moving on, still on science and education, we have the famous working group at IOF. We have more than 10 working groups that are running. Committee of Scientific Advisors of IOF are working on different thematics like bone and cancer, diabetes, fracture, rehabilitation, bone and cardiovascular diseases. The objective of these working groups is to propose a scientific paper and to publish a scientific paper on one side, and on the other side, once the paper is published, to propose a dissemination campaign with an educational program for the healthcare professional and or an awareness communication campaign for the patient or for the policymakers. The idea is really to make the working group and the scientific outcomes from this working group alive and sustainable in the time. Any suggestion for a working group is obviously welcome from all our partners. Still in science, we mentioned earlier the nutrition initiative. The nutrition initiative started years ago at IOF, and IOF developed and launched in 12, if I remember well, an interactive map for vitamin D, and had, back in the time, a communication and dissemination campaign. Based and strong with this experience, we started the calcium initiative 3 years ago to have an interactive map online, and from this interactive map online and from the scientific outcomes and all the data that we have on calcium, to have a huge communication and dissemination campaign globally, regionally, and nationally. This calcium initiative is still going. We are still disseminating all the information and key data for the countries and for the national societies and the healthcare professional. And we would like to move on to a new nutrition initiative, maybe have a conjunction of calcium and vitamin D, maybe having a program specifically on bioactors and bone health. The objective definitely for this nutrition initiative is to sensitize the healthcare professional and the patient at risk of the importance of nutrition intake for bone health. That can be for prevention in primary care or for secondary fracture prevention also. Nutrition is important at all stages. We want to raise awareness on the major nutrients gap worldwide. We want to create tools and material for national societies to advocate in their countries, and obviously to change the behavior of the global population and patient at risk of fractures. Last but not least, for the science chapter, we are going to run, as every second year, a regional congress in Asia Pacific. This congress will take place next year, 2020, in November. I think it's end of November, but I will have to confirm you the dates. This regional congress is every second year, a success. And we are gathering all the scientists, healthcare professionals, yoga investigators, in a region in one moment. We are receiving very high quality abstract from all the participants. The reason why we are picking Asia Pacific to organize this regional congress is because the Asian Pacific situation is very particular and they are facing a rapidly aging population. This is a key region for IOF. Objective with this Congress, improve the identification of high-risk patients, understand the similarities and difference in fracture risk and treatment response between Asia and the West, assess quality of life in elderly patients with osteoporosis, osteoarthritis, or sarcopenia, understand the consequences of low calcium intake, specifically in this region, manage patients with knee osteoarthritis, close the treatment gap by learning about the latest osteoporosis therapies. We are going to prepare a very specific brochure regarding this regional congress in Asia Pacific that we will be happy to share with you later on. Any question maybe regarding the scientific and educational program? No. So let's move on to awareness and advocacy. The Patient National Society Day, we had the first edition this year in Paris. We shared with most of you the activity report of this day, of this event, but we will be happy to send or resend it to you if you didn't receive it. Based on this success, we're going to have the second edition in Barcelona next year. The Patient National Society Day will take place within the World Congress of Osteoporosis in Barcelona, in the same building, which allow us to open the door for any participant, even though this day is dedicated to the Patient National Society's members. This is a capacity building event where we want to provide the National Society with take-home messages so that they can disseminate and work locally with their own members and also with the press and policymakers in their own country. For next year, the highlight of the program will be the management of the disease, prevention, diagnosis, treatment, role of prevention, nutrition, sport and lifestyle, patient empowerment, and of course the IOF new patient advisory board, but I come back on that later. Objective is to engage the patient societies to drive changes for patients at the policy local level, to drive behavior changes, to support the national societies in their work, and to raise the global voice of patients, to urge the policy changes. The Patient Advisory Board, I know that some of them are looking forward to have more information on this new project that we have. Only IOF, as the global leading osteoporosis foundation, can organize such a patient advisory board because we are working as an umbrella for the national societies and representing almost 250 national societies and patient national societies, which are all linked directly with the countries and with the patient in the countries. The operation is to create this board to create this board and to have representative of the patient from selected region. We have 6 regions, and we want to have 2 patients representing the region, patients that are suffering from osteoporosis or that had a fragility fracture. The objective is to address the impact of osteoporosis and bone health related to or related disease on their daily life in order to highlight the gravity of the disease to drive policy changes and impact the policymakers. Definitely, this goes in the frame and in the continuity and consistency of the Give Patient a Voice project that we have this year, started last year, but this year, and also with the Global Patient Charter project that we have. The more we are going to involve the patient in the IOF strategy, and the more we are going to put the patient in the front of the scene so that the patient can share with all the IOF members. They can be scientists, they can be healthcare professionals, they can be corporate partners or national societies. The more they are going to share their experience and how they are living with the disease at all stages, prevention, how they are living with the disease or with the fracture, how they are living with the treatment, how the disease changed their quality of life. All these matters are very important and we need to raise their voice. This is the reason why we want to have this board representing the patient voice. The first patient advisory board will happen in Barcelona. We will have first a closed door committee so that we are going to explain them their role and what IOF can offer them in return. And then the patient advisory board will be presented and be on stage during the Patient National Society Day in Barcelona so that they can have an exchange with the attendants and with the speakers. For this program, very important program that we want to launch, as for any other program and operation, we need your support to help us to provide the maximum comfort and travel for the patient to come and to participate to the event. The event will take place in Barcelona. That will be the first one. But after that, and because we are very keen on having consistency on the operation, we're going to have several webinars or meetings, regional or global, with this patient advisory board. And the idea is to have a second patient advisory board participating and presenting outcomes of the work of the year in WCO London 21. World Osteoporosis Day, do I have ready to present this very flagship important operation of IOF that we are running for more than 10 years. This is a global advocacy and awareness campaign that we are organizing here in the HQ. The communication team is working very hard to provide with all these support material, posters, video in different languages so that the national societies, but also all the members of the network can disseminate and spread the word of the importance of the prevention, diagnosis, and treatment of osteoporosis. This operation is very important because this is for us one way to change the perception of the disease to all the stakeholders, and also a way for us to access the policy makers so that they can change the situation of osteoporosis in their health priorities. This is also for us the opportunity to highlight the consequences and the burden of osteoporosis to the patient. We have different kinds of operations. Last year, we recorded more than 250 events organized worldwide, and we would like to have this number rising too. And for that, we need your support. Partners can be very involved in this important awareness campaign. You can organize something, let's say, in your office, have a dedicated day on October the 20th with your colleagues, with your family, with your affiliates, in your communication. This is how you can be involved. And also supporting us so that we are continuing to produce and to share with the national societies and all members of IOF the material. The campaign this year is, again, to be consistent and to have a long-term vision, very focused on the patient. We are working very closely with the national societies. And today, or at least on October the 20th, we are going to have 17 posters highlighting osteoporosis with a real patient on picture. Patient that will present their own story, presenting the concept of that's osteoporosis. Basic information, again, to change the perception of the disease. Sometimes we need to go back to the essential and to the basic. So the campaign this year is focused on basic information on osteoporosis, that's osteoporosis, and who is suffering from osteoporosis, with the patient representing the campaign. The osteoporosis risk check, this is the version 2.0 of the very famous 1-minute risk test that existed for the last 15 years and was translated in more than 15 languages. The idea was to revamp and update this test, but also to make it more user-friendly, more online or digital using, and also to have it shorter. The risk check is already available online. We are working very hard to have, by October 20th, 28 different translations. We have a full communication campaign around this launch and around the use of the risk check. Our objective is to drive a maximum traffic on the risk check platform. Why? Because first, the patient or the patient at risk will go online to take the test, so that he's going to have basic information on his risk of having osteoporosis or not, because we are highlighting all the risk factors on the platforms. Second, we are organizing a pushback email campaign so that we are going to keep the link with the patient that is taking the test. Third, because we are sending the results of the test to the testee, we are pushing the person who is making the test to go to the doctor and to start the dialogue with the doctor about osteoporosis, risk factors, and options for diagnosis and eventually treatment. This is a long-term operation just starting now, and the more the risk check will be taken online, the better that will be. Again, as I was saying in my introduction, we are capturing more or less 20% of the patient at risk today. The objective is to not even double, triple, or quadruple the patient that we can capture and change the perception and inform about the risk of osteoporosis. I invite you to go to the website and to take the test and to share the test to all your colleagues, to all your company's members, to your friends, on your communication, to anybody. Policy forum. I think it's the last, yes it is. It's the last slide. Policy forum. As I was saying in my introduction, we have two axes: the science and education of healthcare professionals, and awareness and advocacy. And all the work that we are doing has for objective to change the situation in terms of policy in the different countries. The communication that we are preparing, the arguments that we are preparing, the tools that we are creating, everything aims to change the situation of osteoporosis in the list of national health priorities. We started to discuss about this policy forum 2 years ago with Philippe. And last year we started to implement the possibility of having this policy forum. And I'm very happy to share with you that this year, Philippe is starting to, or already start, to participate and to organize this policy forum. The idea of this policy forum is to have a closed door small meeting, small attendees, but to have the right person around the table. Experts, national societies representative, eventually patient representative, but mainly the key person on the governments, the payers, the Ministry of Health, Social Security representative. Philippe did 1 month ago, a big trip, an entire trip to Asia in 5 countries, 5 different countries, to have 5 different policy forums in these countries in Asia. And I'm very happy to share with you that this policy forum in Asia were a success. Situation is changing already in Asia. In 2 weeks from now, he's going to Latin America, 5 countries in Latin America, again to have this closed door policy forum meetings in the different countries there and to make the lines moving in terms of information about osteoporosis to the policymakers, information and education, basic education for the policymakers about what is osteoporosis, what is the burden, what are the consequences, and what are the solutions that we can implement in their own countries to change the burden and to prevent from the consequences of the aging population in these countries. And for that too, we need your support. As you can see, this honeycomb structure of the IOF operations for 2020, the patient is really in the middle of all our reflections, brainstorming, and operations. We are educating the healthcare professional so that he can better consider and care and treat the patient. And all the operations that we are doing has for ultimate goal to change the situation in the countries via the policymakers. This is a sum up of all the operations that we are going to develop and implement next year. Again, this is a continuity of what we started last year and this year. And as I said, this is the program for 2020. And I'm very keen to have this operation again in 21 and 22. The strategy and the objectives won't change within the next 2 years. Unless we are capturing 100% of the patient at risk, this will remain our objectives. Change the perception, inform about the burden and the consequences, and make osteoporosis and bone diseases a national health priorities in all the countries. Key steps for us: pursue the operation, push the dialogue between patient and doctors, activate IOF network and connecting the dots as much as we can between the scientists, between the healthcare professional, between the national societies, patient or medical societies, with the patient and with the policymakers. Today, we have a network that is much more enlarged and we are able to connect the dots. We want to increase the impact of our operations, reason why we are maintaining most of the operations from last year, this year, and next year again. Disseminate massively the material, reason why we are continuing this digital communication campaign for any operation that we are implementing. And again, implementing national policymakers and local task force again and again this year and next year and in the future. Partnering with IOF. I'm sure that's the question that you all have this morning or this afternoon or this evening. There is 2 different options that are not related. You can be a corporate advisors committee member, or you can be a partner, or you can be both. 3 different options. We are very keen to change the proposition for the Committee of Corporate Advisors membership fees. For those who are already members, you know that there is an annual fee. There is first an entry fee and then there is an annual fee. And due to the change of some of our the operation and support of some of the operation, we would like to propose you, and that's a brainstorming, this new level of investment and participation as a member to come to the Committee of Corporate Advisors. To become a member, you have 3 different levels: bronze, silver, or gold. 3 different status for the companies: startup, and we have more and more startups that are keen to be around the table. For those who were present in Paris for the last CCA meeting, we were about 30 around the table, and I would say 1/4 were startups. And I would be very happy, to open the door to startups more and more. Startups in the field of, I would call that the silver economy. How we can integrate the silver economy into the IOF network. Small companies and multinationals. Normal support, silver support that will support also the scientific research and the working groups, and the gold support, the gold level, which will support the basic World Osteoporosis Day campaign. As you can see, there is a little line below the table, which explains that this status do not offer the license to use the material, but only the visibility as supporter for the different operations. This is the vision of partnering with IOF that Philippe implemented when he arrived 3-4 years ago, when he started running the foundation. IOF has his own strategy. You have your own strategy. There is for sure common strategic interest. And from this and the discussion we can have together, we can have tailor-made partnership. 4 important steps. We need to discuss so that we can identify your needs and discuss about what are your strategies, what are your needs, what you are looking for. Then we are quickly responding to, or trying to respond to propose options to answer these needs. If we are partnering together, we are always trying to be as transparent as possible during the operation and share with you a follow-up. And once the operation is over, we are providing with activity report, feedback, ROI, and KPIs as much as we can. And for those who already had an operation with us, I would be happy if you want to share your experience. This is something that we did also during the last CCA meeting in Paris. 3 of our major partners shared their experience with us, and well, correct me if I'm wrong, but I think that the experience was pretty positive, and how we are partnering now with the companies is in a good way, and partners were happy. Easter, I can see that you have a question. What is it? Is there any notes on the Asia trip, and was this changing? Notes, not for the moment, but I know that my colleagues, well, Philippe came back from this trip. It was early September. Since then, he traveled to the US. So I know that my colleagues from communication are working on an activity report from this very important Asian policy trip. So as soon as I have an activity report, for those who are interested, I would be happy to share with you this report. I shared already, and the IOF account also shared already on LinkedIn some of the outcomes of the meeting that he had in China or in Singapore or in Taiwan, all the countries. So you have little information on LinkedIn that you can access right now. An activity report will come later, and this is something that we are going to do also for Latin America. What it changed? Well, 2 weeks after the meetings, I'm not able to tell you what changed really and concretely directly in the countries. I think this is really too soon to have a concrete change, but this is something that we are going to follow up very closely with the support of the national societies locally, because the national societies supported us and supported Philippe in his trip and in the organization of on these meetings. So we're gonna have a follow up with them and track the policymakers to see if there is concretely any change in a close future. That is for sure. Today, no answer yet. Thank you very much for your question, Aristide Grau. And thank you for your thank you. Is there any consideration for rare musculoskeletal conditions in your 2020 plans? Yes, except thank you for asking. I didn't develop that really into details in this webinar. I just mentioned the skeletal rare disorder training course that we have. This is one of the operations that we are doing within the frame of the skeletal rare disorder initiatives of IOF. This is a program that we started, I think it was in 14. 15, 16, we started to develop the content of the course. We also developed the IOF Web Atlas, which is an atlas online, gathering 99 or describing 99 skeletal rare disorders. For your information, this web atlas online is one of the most visited web pages that we have on our website, because the bone doctors are very keen and very happy to have one site where they can go and have a very clear and quick overview of the most important 99 skeletal rare disorders and see a small definition. So that's another operation that we did, and we are going to refresh this page for the new website in the future. Apart from that, and to copy and paste the success of the IOF Calcium Academy, we are keen to develop the Skeletal Rare Disorders Academy. That will be the same kind of activity, a steering committee of experts selecting abstracts from the selection and submission for the Congress, have a scientific review from the steering committee, then offering grants for the young investigators and support them in their future work. We have also next year we have an advocacy and communication campaign program for February the 29th, which is every 4 years. So we want to make a big noise in collaboration with other alliances or societies or foundations that are specialized into skeletal rare disorders or simply rare disorders. So we're going to have this communication campaign that very day. We have also webinars. For your information, we just hold, 3 months ago, we hosted a webinar specifically for Middle East. And this webinar was a success, and we want to have a global one, or eventually thinking about a regional one, but that would be more a global skeletal rare disorder webinar that we want to organize. Basically, that's the program for the coming years, but I will be very happy to share with you the very specific skeletal rare disorder initiatives and program for the future. I hope I answered your question. Well, if there is no more question, I will conclude this webinar. I thank you very much for your attendance this morning. We picked this time because we were trying to reach a maximum of persons, which is not easy considering North America, Latin America, Europe, Middle East, and Asia Pacific, or even Far East, like Australia or New Zealand. Reason why we are recording this webinar And this webinar will be available online, as I mentioned in my introduction. I invite you to share the link with your affiliates, with your colleagues, and we will add in our email our personal data, Emma and myself, so that you can reach us. And as I said, we can set up meetings in person, that would be great, or calls so that we can answer your more specific questions and discuss about a specific program more into details. As you can see in these slides, I didn't mention any budget specifically. Let me tell you why. The reason why is that, as you could see in the structure of the fees for the membership, we have startup around the table, we have SMEs, and we have multinationals. I don't want to close the door to anybody. So if a startup wants to support one program, I cannot propose the same price as a multinational. That's for sure. Obviously, if it's just for one country or if it's for the worldwide, that won't be the same either. To make a long story short, the bigger the support will be in terms of country reach or operation or activity, the more that will be. And if some small companies want to participate, we are opening the door for them. We want to have tailor-made, customized proposition for each of you. I hope to see or hear from you very soon, and I give you a rendezvous for next year, September or early October, for the presentation of the Operation 21. And I count on you to come if you didn't receive the save the date from Emma yet. There is the Committee of Corporate Advisors meeting on November the 19th in Geneva. All the members are obviously more than welcome, but those who are interested to come as observer, just to see and try this meeting, this brainstorming meeting, they are welcome. And definitely, I look forward to seeing you all in Barcelona. Thank you very much. I wish you a nice day or a nice afternoon or a good night if you are far away. Bye.